So this is a ResMed S10 CPAP unit. This is a standard machine. With your machine, you get a water chamber. The water chamber is what helps to create humidity for comfort. It slides right in this particular model. Also, with your machine, you receive tubing. Comes in a couple different styles. This is just a standard tubing, and the tubing actually goes right into the back of the machine. On the side of the machine is a filter system. This helps keep the inside of the machine clean. You also receive with your machine a mask system. This goes right on the face, and this is what delivers the air pressure from the machine to your body. The best practices for cleaning and maintaining CPAP machines and accessories are: create a schedule. Use your device, whatever it may be. Use your calendar. Write it in your calendar. It literally takes 5 minutes to do the process, half hour to soak the water chamber. It's always a good idea. Set the reminder. It doesn't take long. So just like any other habit, you create the habit of cleaning it. If you do not, you will get away from cleaning. You'll forget, out of sight, out of mind. So I always encourage my patients, put it in your smartphone, write it on your calendar. It doesn't take that long. How often does the CPAP and accessories need to be cleaned? The manufacturers recommend once to twice per week. That is based on the need, the environment. I have patients that live maybe in northern Summit County in the Metro Park area. They may get a little more environmental dust. But I recommend at least once a week you give the machine a thorough cleaning. It's very simple. Warm water, mild dish soap, and white vinegar. That is all you need. Everything you already have in your home is exactly what you need for cleaning your CPAP unit. So the cleaning process is taking just a soft cloth and wiping off the outside of the machine, wiping where your water chamber is. You do not need to use detergents on your machine. For your water chamber, what you're basically doing is you're clamshelling this open. You're putting white vinegar and warm water in this, closing it, and you're letting the water chamber set off to the side for about a half hour. White vinegar will help to sterilize the device. After about a half hour, you open it up, you turn it over, rinse it out really good, and just let it air dry. This particular water chamber does have a gasket that can come out. Keep that clean. You can take it out and you can soak that as well. For your tubing, very simple process. You can put it in the sink, let it soak in water, or what a lot of people like to do is take that mild dish detergent, put a dime-sized drop in the end of the tube, you fill it with water, you swish it around really good, you rinse it with hot water, and then hang it up over the shower head to let it drip dry. The actual cleaning process takes about 5 minutes, but you do want the water chamber to soak. As far as your mask goes, the mask and the cushions can be wiped down with a soft cloth. Some people say you can soak this in some vinegar. We recommend a very mild baby butt wipe to wipe this off if you feel like you're not getting it clean. In the headgear, you just soak it in warm water, rinse it out, squeeze it, and you put the headgear on a towel. You want it to air dry in a towel. You don't want to hang the headgear and stretch it out. So this little filter needs to be taken out of your machine once or twice a week. And what you do is you just basically smack the filter to get the dust off. And then every 2 weeks, you put a new one in. What I like to tell patients to do is take the pack of filters they get, put it by the machine as a reminder that needs to be done. Besides the damage that the dirty CPAP to the motor, the majority of the motors we send back for warranties or devices are because there's dust and contaminants on the motor. So you're also talking about humidity, you're talking about moisture, you're talking about bacteria. And these simple cleaning processes will help keep the machine clean. It'll help keep the tubing and the water chamber free for any of those bacteria. You do not want to be inhaling bacteria and mold from the machine because you don't take the few minutes to clean it on a regular basis. I tell patients that are subjective to maybe a high risk of respiratory diseases or coming out of COVID, they use their device with COVID. I would encourage them, throw them away, buy new stuff. It's not very expensive in the long grand scheme of things. But yeah, clean it as needed. Clean it more if you feel like you're coming out of a cold or a flu. I would recommend cleaning it a couple times a week with hot water, warm water, white vinegar, and soap. With an improperly cleaned machine, you can get further infections. These machines, they use distilled water to create humidity, but even distilled water do have some additives in them. You will notice a machine that is not properly cleaned will start to have a moldering in the water chamber. You'll start seeing dust particles on the machine. Within the tubing, you could potentially see buildup. And as you inhale that, you could exacerbate underlying medical conditions. In my office here at the hospital, I'm in the pulmonary group. We see a lot of lung diseases. We encourage these patients, be smart, be diligent. It doesn't take long. It's not expensive to clean the machines. There are a lot of automated devices on the market that use either infrared light or ozone cleaners. These devices have not been approved by the FDA. The CPAP manufacturers do not recommend these, and they could void your warranty. Now, we've been using soap and water on CPAP units since the 80s. It's the best way, the highest, and the most recommended way to wash the CPAP unit. There are a lot of different environmental, and the thing you said was dander from animals, the hair from the animals. Being in an environment where your machine is near a heat source, where their furnace vents are at. I've seen people put their machines by a vent, not realizing that is blowing filtered air, but that air is filthy. That all contributes to it. Dust from trees, mold from trees. Mold in the home, we don't think about that, but mold in the home, this machine takes air from your environment and it filters that air. If you're filtering extremely dirty air, you're not fully filtering that. And by cleaning this, taking care of the filter, that is the main thing. The filter is a huge part of keeping this machine clean. Your machine does not use a lot of water. There's a plate inside of the machine, and what the plate is doing is warming up. I know it's hard to see. It warms up and it creates humidity from the humidifier chamber. Distilled water has the least amount of trace chemicals in it. Now you have to be careful. There are distilled waters with added chemicals. You do not want that. When you're creating this humidity, you will be inhaling those chemicals if you're not careful. Tap water has a lot of chemicals in it. Purified water, spring water have a lot of chemicals. Distilled water is the best thing to use. It is the best in eliminating those environmental chemicals and man-made chemicals that get added to our drinking water. So I've had units that have lasted for as many as 15 years. Your insurance company, depending on who they are, will agree to replace a machine on an interval of about 5 years. Not every insurance company is different, but on a 5-year basis. Your supplies, your insurance company, most cases, will replace a piece of tubing every 90 days. They will give you 2 filters per month. They will give you a brand new water chamber every 6 months. Your mask is replaceable every 90 days. And the cushions on the mask, depending on what kind of mask you use, is replaceable 2 per month or in a full face once per month. Your doctors, the manufacturers, your insurance companies all agree that you should stay on that replenishment schedule. As you can imagine, a great replacement schedule is because this water chamber is heating and cooled. Things like the plates start to change color. Even with distilled water, you do get some chemical in there. With the filters, they get dirty, they break down. You don't want a filter disintegrating in the machine. The water tubing or the tubing, it is constantly being processed with pressurized air and warm air. They do get brittle. Cats like to play with them. They'll poke holes in it. Your cushion, the lighter they've made them and the least infectious they've made them, they've also made them softer, which makes it a different type of component. These will break down. We do sweat at night. We have hair oils. We slobber at night, and that does break this down. And of course, you're talking about your headgear, which is replaceable every 6 months. This is wrapped on your head. And you do get hair oils on this, and it does break down over time. Where's the best place to put your CPAP unit in your bedroom? I recommend the best place for it is on a nightstand, level with your head. If you cannot do that, the floor will be okay. Now, you will get a little more environmental dust on the floor, but where I don't want it is over your head. I don't want the device to be pulled off and the water get in the machine, or worse yet, hit yourself in the head with the CPAP unit at night. The cord needs to be plugged directly into the wall or a power strip that does have a ground on it. No cheap extension cords. And the main cord is about 12 foot long, and with the 6 foot tubing, you have plenty of room to get this to where you need to be comfortable. I think having things on the nightstand is becoming a common occurrence now. My cell phone sits on my nightstand. I prefer the machine to be by itself. I would prefer there are no heat sources. Obviously, a lamp is not a heat source, but to have anything that would create heat. But also, candles are a chemical. You're burning that, and then you're pulling that chemical in there. You don't want to be inhaling that on a regular basis. This is a more direct sense of that air coming in. It's not like you're smelling it in your environment. You're actually pulling it through the machine and getting it directly in. So I don't think having it near that is a good idea at all. So what I do recommend in the morning is that what a lot of people like to do, and what they should do, is they should take a water chamber, open it up, and get rid of the extra water. It is not a lot. You don't want to keep using the same water. Some people like to take the tubing off and hang it up because there is some moisture in it. But I will tell you, with this specific model, it has a feature that when the machine is turned off, the machine will continue to run, putting a little bit of pressurized air out. You could barely feel it. And what that is doing is actually cooling the machine down and drying it out. Most people, such as myself, I just put everything on my pillow. Some people totally disconnect everything and hang it up. It's whatever you're comfortable with. And you'll notice dirt on it. You'll notice what you need to do. It doesn't have to be a daily cleaning unless you feel like you need to. Again, 5 minutes to wipe it down to prevent any further damage is probably a smart thing to do. Yes, most insurance providers, including Medicare, Medicaid, all government providers, cover the cost of a CPAP unit, BiPAP, or anything else. Some plans, very rare, do have a carve out where they will not pay for a machine. Now, they may pay for the testing, but they will not pay for the treatment. We work with patients that do not have coverage for CPAP units, and we will make sure that they get what they need.